next one is pretty interesting in many ways. It's demo on AI for healthier policyholders by Fitterfly. Fitterfly, interesting, was started by a medical doctor who is gold medalist from AIMS, still does surgeries, started a Insurtech startup, which I think is pretty unique for any doctor to do it. It started for a reason which is equally interesting, a doctor being diagnosed as a patient, and that led to the research around how do you make someone fitter in life. Dr. Arbinder was diagnosed as pre-diabetic in 2019, which led to the research and building of Fitterfly. I think it's a good idea to invite Dr. Arbinder and take the stage. Thank you, Doctor.
Hi everyone. When I walked in here, I thought some parts of it looked like a medical conference. Being a part of startups for the last few years, I've been attending more of startup conferences and now lately for the last 1 year insurance conferences. So thanks. I would speak about how actual AI should be used in clinical usage. You know, most of the time, AI in healthcare means doctors ask, is AI going to replace us? That's the question. But generally, we are using AI at Fitterfly to actually augment and facilitate lifestyle management for very complex clinical conditions. Can we have the slides up, please? Sorry, there always has to be a glitch when a doctor comes on board. So they always say save the best for the last, but we are saying save the best for the second last. I think there's one more presentation after this. Great. So we believe that technology should be made with only one goal in mind, especially when it comes to health, that is to improve the outcomes. A lot of startups have tried to do technology which can improve doctors' workload or some kind of hospital management or claims, but the final goal of technology should be to improve the health outcomes. And we all know this problem. I think people sitting here are trying to solve the insurance problems in various ways. We believe that since now diabetes and heart disease are coming at earlier age, the average age of onset of diabetes is now 38 years in India. Unless we solve this problem at scale, no amount of getting more doctors, more medicines or diagnostics is going to solve this problem. So what we have done is we have built meaningful technology using AI at scale, and we learn from our own data. So AI, for training AI, all of you know we need a lot of actual patient data. So the first 3 to 4 years of Fitterfly, we had millions of interactions with our own members, which allowed us to build a very meaningful technology here at Fitterfly. And the basic core calling, when you talk about people, you know, everybody is not as digitally savvy. So you make sure whatever you're building in AI or technology has to be very simple, it has to be very predictive, and it has to be personalized. The way you manage diabetes in a person who's a frequent traveler and an office goer cannot be the same that you manage diabetes in a homemaker. So it has to be different for each of these personas. So these are the AI products which we'll be doing a short video recorded demo today. And I'll speak briefly about how we have done them and metrics behind them. And finally, we'll show you the video of how it actually works. So the first problem which we were trying to solve is, we know that actually understanding nutrition is the key to 80% of disease management. Most of the people really don't know if their food is healthy or not. And entering the food diary, which we were doing the initial first phase of Fitterfly, was typing. It was quite painful for the customers to type in every day. Then we created a voice agent, and finally we moved up to a video cam kind of agent. And this is based on Fitterfly's largest food database, where we generate millions of diet plans every year for a lot of pharma and insurance companies. So how this works is, in step 1, you click a picture of the meal. Step 2, our AI analyzes the components of food and the quantity of the food, and then immediately meaningful insights are generated. Now, what are the metrics? Currently, our system is logging in almost 300 meals a day using pictures. We have total 1 million plus meal logs which have been generated. We run India's largest food database, which is used by doctors, nutritionists, pharma companies, insurance companies. This itself has won multiple awards, and we cover the largest amount and variety of foods which people across in India eat. The second product which we built was solving the problem for understanding the lab tests. I know a lot of companies have done this, but what we have layered on top of this is, besides making it easy for the customer to understand what their blood tests mean, is to also give them an actionable advice. So for example, if your HbA1c is high, what can you do to lower it? Or if your LDL cholesterol is high, can you click and generate a diet plan which will actually lower your HDL? So I think going beyond simplification to an actionable smart report is what Fitterfly has done, and we'll show you a demo of this. So currently we launched a beta version in India first, but this is mostly live in Dubai with a couple of insurers. This is just early days. We have generated about 150 reports, 700 plus validations, and we cover about 200 blood tests right now, covering about 20 health panels. And the biggest achievement till date at Fitterfly has been building a virtual CGM. How many people in this room are aware of a continuous glucose monitor? Show of hands. Only 4 or 5 people, okay. So a continuous glucose monitor is a small device which you put on the arm, and it gives you continuous blood sugar reading. So typically earlier, in the early days of diabetes management, people were either pricking themselves to know the blood sugar, or they were going to the lab and doing the blood tests. With continuous glucose monitor, once you put this device, it can give you a continuous blood sugar values, and you can understand what kind of foods, medicines, sleep and exercise is impacting these blood sugar levels. So you can make better choices. For example, when I used to eat Maggi, my blood sugar used to rise by 60. But I understood if I eat half the Maggi, eat a salad along with, and an egg, my blood sugar rises only by 20. And if I go for a 750 steps walk after eating Maggi, it doesn't rise at all. So it can help you really understand what is happening in your body. And this is different for you and different for me. So this is how continuous glucose monitor works. But the problem with CGM in a market like India is, it costs 5,000 rupees. So what we did was, since we had thousands of people using a continuous glucose monitor in our systems, and we were knowing that a person in Chennai is eating idli and is 35 years of age, his HbA1c is so much, then how much the blood sugar rises for that person. Versus a person in Punjab eating chole bhature, 40 years of age, how much his blood sugar is rising. So we built a system where we got all this data in, and finally built a model where we can predict how much blood sugar will rise for people across India. So this is a PGI prediction model. We recently got a patent for this. This is India's first patent in artificial intelligence for glucose prediction in India. It's a dual model. You can do it at a population level for people like me, or more accurate is, if I've won a CGM for 14 days, then 15th day, it automatically starts predicting, and you can just click a picture. It'll tell you how much your blood sugar will rise, and we can do it for 40,000 Indian foods currently. And the last thing, gentlemen, can you please give me some leeway here for the last presentation? Some little less sound, please. Okay. Feeling like a teacher here. Okay. So the last thing which we have built is a AI model, which is a coach. In here, people can come in and ask their queries. Now, what we did differently was, we had 300,000 coaching sessions which were recorded in Fitterfly. 3 lakh sessions with our coaches, psychologists, physiotherapists, nutritionists, and we created an internal knowledge base. If somebody is coming and asking, can I have a coffee, can I do exercise, what is this medicine, I'm not able to sleep at night, I have a knee pain, back pain, what kind of medically accurate advice should go to that specific person, considering that we already know what is the persona of that person. So this tool is called Jedi, jovial empathetic diabetes intelligence, but more from the Star Wars, may the force be with you. So we created this agent which is live in our app, and currently nearly 30 to 40% of the support inquiries are managed by this agent alone. So we answer almost 4,000 queries every month, and once a user comes and uses Jedi, they are on it for almost 4.5 minutes. We have data recorded of 300,000 sessions. We cover 10 plus themes, meal analysis, recipe, diet plan generation. We generate almost 100,000 diet plans a month right now using various tools. Exercise guidance, pain management, sleep management, stress management, all that is quite automated within the platform. It's time to go into the demo. Can we have the video, please? Excuse me, can we have the video, please? We still have got about 10 minutes.
Fitterfly has created an AI-led wellness journey that supports people with diabetes, obesity, and heart health concerns in achieving better outcomes. It all begins with lab reports at the time of diagnosis. When most of us receive a blood test, we are faced with hundreds of markers and medical jargons. Only a few highlighted values get our attention, and Googling it just leads to more confusion and anxiety. To make sense of the data, you can upload your lab reports into the Fitterfly app. Within seconds, Smart Reports converts the data into simple language. The report is summarized into body systems, showing which areas are fine and which needs attention. From the many markers available, Smart Reports highlight the ones that are most important. Each panel explains how individual markers link to areas like heart, liver, kidney health, and more. Along with explanations, Smart Reports also provides diet and lifestyle recommendations based on medical guidelines. Lab reports reflect your eating habits and lifestyle. To make daily choices easier, we built Click, a simple way to track and improve meals in just 3 steps. Step 1. Click a picture of your meal. Step 2. Our AI instantly analyzes it against a verified database of 37,000 plus Indian foods built on IIA and NIA standards. Step 3. You get clear insights, detailed nutrient breakdowns, and a food score. The food score rates your meal from 1 to 10. Showing how balanced your plate was, which macronutrients like carbs, proteins, fats and fiber, and micronutrients like calcium, iron, zinc, what was in excess, and how to improve next time. It's like having a nutritionist review your plate every time you eat. But it's not just about what's on your plate, it's also about how your body responds. That's where our proprietary virtual CGM or VCGM technology comes in. It shows how your meal is likely to impact glucose levels over the next few hours, flagging potential spikes and suggesting alternatives. Powered by Fitterfly's rich data set, our models combine population-level intelligence with your personal patterns to deliver a highly accurate, personalized glycemic response prediction without the need for a physical CGM. And finally, for all the health queries that come up at any time of the day, Jedi, our 24/7 wellness coach, is always there. It gives instant, clear, and actionable insights on diet and lifestyle. It's like having a trusted guide in your pocket anytime you need it. Fitterfly brings together Smart Reports, Click, VCGM, and Jedi into one suite. These tools simplify lab reports, analyze meals, predict glucose responses, and provide round-the-clock guidance. Together, they make prevention easier to understand and act on.
Can we go back to the presentation, please? So at Fitterfly, we've been running disease management programs, and as we have grown, we have incorporated more and more automation. At diabetes, we have the industry-leading outcomes of 1.5% HbA1c reduction. Heart health, we focus on LDL reduction, BP reduction, and weight loss also. With insurers, we are working closely with leading insurers in India, where our primary aim is to lower the claims over a longer term. But from the policyholder perspective, we make sure that they're engaged, they're healthy, lower hospital rates, lower medication burden. So till date, there are more than 100,000 app users, 30,000 premium plan members. So we are research forward, more than 80 research papers. We work with top 3 insurers, top corporates, as well as pharmaceutical companies, and we are ISO certified. So overall, we remain committed to our goal of making a clinical impact, helping 1 billion people across the globe get better clinical outcomes. Thank you very much. This is a team. Our team, Anjali leads the enterprise business. She's here. And Arpita leads the AI Innovation Center at Fitterfly. Thank you very much. We have about 5 minutes left. If there are any questions, just go to Play Store and download Fitterfly app. That's it. So we do retail programs as well as through corporates and insurers. So all three models exist. Plus it's a prescription therapeutic by doctors as well. Yes. Jedi. See, ChatGPT, if you ask us to make a diet plan, whatever commands you give, it won't be India-centric. And you can open the Fitterfly app, ask a relevant question for diabetes to ChatGPT and to Fitterfly. You'll see the responses will be very different. Because here we put a lot of guardrails which are India-specific, and all the recordings of coaches which we have done in how an Indian dietitian or a coach would advise a diabetic patient in real life, that is the LLM on which it's built. So it's a lot of India-centric, actual clinical responses which have gone into building this. I would say, Arpita, you want to answer that? How much is internal and how much is external? So currently in Jedi, what we have also done is we have taken the physiotherapist full module. If you have a pain in the neck, you can actually generate a pain management plan for 6 weeks in Jedi. Or diet plan, stress management, sleep, like you're not able to sleep at night. You can go to Jedi and ask it a question. It will give you some kind of 1-minute therapy so that you can sleep better. So all those things have been done into Jedi. Great. I think it's the last and the best presentation coming up. Hold on, guys. Thank you everyone for listening in.